question here. The nurse entered the client room and the client immediately demand to be released from the hospital. So this is the keyword. My patient want to release from hospital. During review, the client record or history, the nurse noted that the client was admitted 2 days ago for the treatment of anxiety disorder. This is the keyword. And admission was voluntary. So patient want to be cured, willingly participate in the treatment procedure because of anxiety disorder. But now patient want to go for the release. The nurse reported the findings to the register nurse and expected that the RN will take which action. So the call the client family, then to persuade the client to stay in a few more days or contact the primary healthcare provider. So any adult patient, and this patient willingly to get admitted to the hospital, but they have a right to release from the hospital when they want. So you never persist them to continue to stay in the hospital if they don't want, right? So before to contact to the patient family or anything, better to contact to the healthcare provider about the patient desire and tell the client that discharge is not possible. No, it is not good answer. It is again to the patient. So best option, contact the primary health care provider for next decision, right? What should do. So the rationale, generally the voluntary admission is by the client, always happened by the client. So it is the involuntary and voluntary. So voluntary means patient want to get admitted to the hospital to be cured. Involuntary means in psychiatry word, because patients do not have any relation with the reality. So they do not want to get admitted to the hospital. Sometimes the patient guardian or family member bring them to hospital for the treatment because they are not safe for themselves, they are not safe for the surrounding peoples, right? It's called involuntary admission. But both cases, if patient want, they have a right to release from hospital anytime. So voluntary client have the right to demand and obtain the release. So the best nursing action to contact to the healthcare provider. So the anxiety disorder, basically, when we get any patient have an anxiety disorder, the most priority is the safe environment. So safety is the most important for them because they are harmful for themselves or they are harmful for others. So Nclex board asks the question, what are the most priority if the patient has the anxiety disorder? We provide them safe environment, right? And also it is important, beside of safety, we provide the support for caregiving. Also, we refer them to community resources or attempt to have a consistency of caregiver. So there are three types of anxiety disorder: mild, moderate, and severe or panic level. the mild anxiety associated with everyday life and can be motivating, or behavior they look like the tapping the food, so many behavioral disorder. And in case of moderate anxiety, the patient uh, focus is on immediate concern. If our patient has a moderate problem, so our main focus is on immediate concern, and they have a narrow perceptual field. What does it mean? Means it is relating to the ability to interpret. Also, the moderate anxiety, it is they have a learning or problem solving can take place. Behavior problem and also difficulty of concentrating. What about the severe cases? In case of severe anxiety, the patient faces a significant reduction in perceptual field. They have also difficulty of focus in one specific details, or they have a problem in the learning, and problem solving cannot take place. Also, they need the direction of focus or difficulty of following your direction. So if the patient has a severe anxiety disorder, it is important it become aware of something thought. And also, in case of the panic level, the patient have a sense of impending doom. What does it mean? It means a sensation or the impression that something trigger is, but the really this trigger is absent. So they feel something, but there are no relation with the reality. So also in case of panic, anxiety, they have a personality problem, like personality is disorganized and cannot communicate or functional effectively. Also, patients have a loss of rational thoughts. Patients sometimes have a delusion or hallucination in case of panic anxiety. So if your patient has anxiety disorder, we give them anti-anxiety medication, right? Like benzodiazepine or other tranquilizer is very helpful for them. A client is admitted to the psychiatric nursing unit. When collecting data from the client, the nurse note that the client was admitted on an involuntary state. So involuntary state means patient do not want to get admitted to the hospital, but maybe something is wrong with the patient. Maybe they are harmful for themselves or they are harmful for surrounding people. So family members or guardian bring them to hospital to admission. Based on this type of admission, which would the nurse expect to note? Involuntary state and also psychiatric unit. So patient have no reality with realities, right? So in that scenario, and what are the conditions we bring them in hospital for the treatment basically, right? So this is the client present a harm to self. The client request. It is not answer. Number two is not answer. The client request because it is involuntary. The client consented to admission. No, right? They don't want to participate to be cured. The client provide a written application. Definitely no. So only the client may be the harmful for themselves or surrounding people. So need to admission. So what are the rationale? Involuntary admission is made without the client consent. Involuntary admission is necessary when a person is danger to self or others, is in need for psychiatric treatment or physical care. What next? Question here, the following a group therapy session, the client approached the nurse and verbalized need for seclusion because of uncontrolled feelings. The nurse report the findings to the registered nurse and expected that the RN will take what action. So if any patient need to the seclusion or restraint, the RN are not allowed to do this. They need doctor order, right? In yes, in some medical condition they do this, but they must need to inform to the healthcare provider. Like your patient has a seizure. So out of four, which one is the important? Take the action. Call to the client family, never. Call the client, place the client seclusion or restraint immediately. Definitely no. Inform the client. So we need to assessment, evaluate. We need to inform healthcare provider. Then we go. Inform the client that seclusion has not been prescribed. Also, you do not tell it to that patient. Maybe patient will be upset. So best option here, get a written prescription from the primary care provider and obtain the informed consent. So when any kind of seclusion need, it is important we have to must follow some details like what are the type of restraint, what are the reason of the restraint, what are the location of the restraint, and also the duration, how long it would be continue. So answer, but we need the doctor order first. So what is the explanation? The client may request to be secluded or restrained, but we need the doctor order first. The federal law requires the consent of the client unless an emergency situation exists in which is immediate risks to be the client or other can be documented. The use of seclusion or restraint is permitted only with the written prescription of healthcare provider and which must be reviewed and renewed every 24 hours and depends on the state law requirements as well. So when any question comes about the restraint, or seclusion, you have to know some points. First of all, restraint, we need the restraint prescription. And as a healthcare provider, must you have know the followings, like what are the type of restraint? Is it physical restraint? Is it chemical restraint? Physical restraint means like tied up, belt. Chemical restraint means some tranquilizers, sedatives. Also the reason why you have to put the restraint or seclusion. What the location? Is it in the hand or ankle joint or over the wrist? Also, how long you continue the restraint? And also, we need to know some information for Nclex board. So the prescription must have need the doctor order, and doctor need renew every 24 hours physically, and only RN put the restraint or seclusion with doctor order. When you done everything, you can write details, or like in a midnight, a patient need to put the restraint, we do it by verbal order. But only RN can take this verbal order, and we need two RN to read the order, right? So if anything is happen, we keep it incidence report. But keep in mind, incidence report never put or written into the patient chart. Important for Nclex board exam.